Hi everyone, welcome to researchmd.com. We got another scientific evidence. We're going to look at it. Our clinical question is today, does handle higher than the saddle in a bicycle cause erectile dysfunction after long distance cycling event? Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency, and I teach medical students and residents. I'm also a director of research. I'm an assistant professor of medicine also. So let's get into our topic. So when we talk about erectile dysfunction, it's very, very common than we think. Almost like 20% of the people aged greater than 20 is suffering from erectile dysfunction. Okay, so when you look at the mechanism, it's when it happens is like you have the arousal, there's parasympathetic response, nitric oxide release, finally you got GTP converted to CGMP, and that is kind of turned into smooth muscle dilatation, then you get the erection. Below that, that's where the phosphodiesterase inhibitor, what it does is like it blocked the CGMP to 5-GMP, so more CGMP available, then you have more smooth muscle dilatation. That's what Viagra works and all that, okay? Now, risk factors, so many risk factors. There are a lot of things, especially with age. The older we get, more likely, a lot of medical conditions, high blood pressure, diabetes, you name it, to smoking, obesity, injuries, medication, like a beta blocker use to control the blood pressure is also very common. Drug and alcohol use. And above all that, like also you have to think about psychiatric problems causing it, okay? Now, long distance cycling or bicycling, how does it affect the erectile dysfunction? When you look at it, when you sit on a bike and when you ride for a long time, there's a lot of compression on the pudendal nerve and pudendal artery, which is supplying the erectile region. Okay, so we found the next step is to find a study, did a literature search, and we find this great study published, and we're going to look at it, right? So objective of the study to investigate the effect of handle higher than or even with the saddle versus handle lower than the saddle, and the effect after a long distance cycling event. So we're going to look at the effect of the handle and the saddle, higher or lower, which one is better, okay? And the design, there's like 463 cyclists they followed in the study. They have completed cycling 320 kilometers and they never had any erectile dysfunction problem. So results clearly showed that when you use handle higher than the saddle, so the handle is higher than the saddle, there is an increased risk of erectile dysfunction when compared to the bicycle with the handle is lower than the saddle after a long distance cycling event. Relative risk is like three times more likely with a confidence interval between 1.1 and 9.3, p-value 0.032. Okay, so clearly based on this study, the conclusion is that there is an increased risk of erectile dysfunction when you're using a bicycle with a handle higher than the saddle in long distance bicycling. It can contribute to erectile dysfunction. Okay, thank you very much for joining. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.